today's TMJ4, this is 4-1 Forward.
Republican leaders are working to convince members of their own party that their proposal is a step in the right direction.
But it's not just a political story. Here is a personal story of a Trump supporter from Slinger who once disliked Obamacare, but now needs it to survive.
Could you have afforded that chemotherapy without Medicaid, without being on that program?
No.
And it was only that expansion of Medicaid that allowed you to be on that program.
Tiffany Koehler doesn't like Obamacare's individual mandate. Like many Republicans, she prefers market solutions to health care. But
when we all want to thrive and make America great again, as he would say, but we can't do that if we're struggling to pay bills.
3 years ago, she had employer-based insurance, then lost her job. She went on Obamacare for $400 a month, then decided to take a chance.
And I need your help.
She ran for office and lost. Then some really bad news. Cancer, stage 4, non-Hodgkin's lymphoma.
My prognosis was poor. I wasn't supposed to survive.
By that time, she could not afford insurance, qualifying for Medicaid. Wisconsin expanded its coverage under Obamacare, but rejected federal funds to pay for it.
Was it difficult to rely on the government for health care?
Well, not necessarily. It was life or death for me.
The American Cancer Society estimates today there are some 1.5 million Americans with cancer on Medicaid.
Anyone who's in the Medicaid expansion, who are really the lowest income Americans, and many of them are cancer patients as well, including childhood cancer patients, are going to be losers.
The Center on Budget and Policy Priorities estimates the GOP plan will gut more than $500 billion in federal Medicaid spending over a decade.
For people like Tiffany Koehler with pre-existing conditions, her health care costs are already over $1 million. Tiffany is joining us this morning.
So we've got to ask you, are you worried with what's going on in D.C. right now? Do you think any of these politicians, Republicans or Democrats, are listening to people like you as they try to figure out health care?
Well, not necessarily. It's nerve-wracking. We, like myself and many other cancer survivors and people currently fighting for their lives, we fought the battle, and there's people all across this country and right here in the state of Wisconsin that are hooked up to chemotherapy machines. They're hooked up to, life-supporting systems, and we can't jeopardize being unplugged from those.
So what do you think needs to be added or taken away from the current plan that's being proposed?
Well, like myself, all along I have said that I didn't like the federal mandate saying that you have to have insurance.
Why not?
Some people don't believe in Western medicine. Some people pursue their own type of therapies, and that's part of the freedom of being in our country. And we also didn't like, it became very expensive. And that's one of the reasons that I was not able to stay with the Affordable Care Act. I became unemployed after our nonprofit was acquired by a larger nonprofit. And so I paid as long as I could, which was just under a year. And I had to start looking at other ways to keep insurance for myself.
And Medicaid worked for you, the Badger Care program.
Yes, Badger Care Plus. Under Governor Walker, he was able to redesign it to meet the needs of the federal programs without taking federal dollars. And so it worked out really well. And now I'm back to work and I have insurance again from my employer.
So when you look at insurance, what did you find in that journey of yours, working, then being unemployed, then coming down with cancer? What worked for you?
Well, what worked for me is the overall philosophy, I think, that has driven our country, and that's that people have access to affordable health care, or there's a safety net to help Americans like me that when you're unemployed, when you've exhausted all your resources, that you're able to receive a little boost. And I did that. And unfortunately, during that period, I didn't know I was fighting for my life, and I became diagnosed. But as soon as I got done with my treatments and I was placed into remission, and I did extensive rehabilitation on my body because my body was pretty much destroyed from my cancer. I had stage 4 non-Hodgkin's lymphoma, and cancer presents itself differently in everyone. So I don't want anyone to get scared, but I want to be a beacon of hope for people because you can beat stage 4 and go back to work.
And you've been cancer-free for how long?
Just a few days ago, it was 17 months.
Wow, congratulations. Tell me this though, you talk about, having access to affordable care. Before the ACA, there was no access for everyone to have affordable care. Do you think that we are moving in the right direction into tweaking what was already established in 2010 to what now the Republicans are looking to do?
I'm not really sure. I'm not an expert. I'm an expert on my experience and being a cancer survivor. I'll leave all the details and the politics to Washington, D.C. But I do know just less than 6 months ago, there was strong bipartisan support to pass the 21st Century Cancer Act. And I think, the will's there. And I know that the president's budget is out, and like any budget process, there's going to be a lot of back and forth, as we see right here in our state. And I do believe the political will is there to, keep the funding in place, but that does not mean that any of us can just take that for granted.
But let me ask you, Tiffany, being you are a cancer survivor, being that you understand the process that you went through, thankfully, and you were able to cover your needed care, what would you want politicians to know as they go forth, trying to figure out what is the right thing to do from someone who has experienced not having insurance, getting insurance, and then having a life-threatening disease that could take you out financially?
Well, I just would want them to know this isn't really a bipartisan issue. It's not a Republican issue or a Democratic issue. It's an American issue. We all have to look after each other and our families, our friends, our neighbors. And this is what we have right now. And we can't jeopardize in getting rid of everything, or, because we're getting so many different mixed messages. But to a cancer survivor and a family going through the fight right now, I would just suggest call your legislator, call, your senators, and just let them know, what position you're in. Because, the community can do so much, but we need dollars for research. We need dollars to survive.
Especially under the cancer research and dollars for that. But when you look in terms of the insurance, do you think the lawmakers are listening in D.C., or do you think the lobbyists get their ear more than folks back at home?
No, I'm pretty confident. I think we have a really good Wisconsin delegation representing us in Washington, D.C. They get it.
They get it.
They get it.
So you're hopeful.
I'm very hopeful, and I know that here on our local level, our governor has got it, and I just want to let people know, reach out to some of the non-profit, non-partisan groups, like the American Cancer Society, leukemia, lymphoma, whatever your cancer is, and they'll explain it to you.
Well, thank you for sharing your story, and good to hear that you're doing better now.
17 months.
Thank you.
So.